Thanks, Seamus. Actually, I'm actually talking about Precision Oncology Ireland, not NCTOG, but I can take questions about that if people want afterwards. I guess we were. You must be tired of me coming to this meeting, so I said I wasn't going to talk about the fact that we're still waiting on CTAC to be developed, because I agree with you all, it needs to start ASAP. Precision Oncology Ireland 2 was launched last October. This is the biggest investment in cancer research in the history of the state. It's a €27 million investment, co-funding, and is built on the back of Precision Oncology Ireland 1, which was led by Walter Colch and Liam Galler, who are here, and was immensely successful. And I think one of the big things that we want to do with POI 2 is to move more towards the clinic, but also maybe to allow people to feel that they're part of a translational research environment, whether they're in a hospital, in a GP practice, or in a lab in one of the universities. And that's not an easy task, but it's definitely something that we're trying to work at, and it's part of multiple different strands of really exciting things that are happening in Ireland at the moment. There are obviously the accelerated research commercialisation hubs. Liam is leading one of those, which are SFI funded, or Research Ireland funded hubs now, which are really important. And we will, on the 10th of June, be launching some really important new Research Ireland centres, which I think will really be exciting from the point of view of things like cellular therapy in Ireland. And in the background, obviously, many of you here are working with us on the National Cancer Research strategy, which we hope will be ready, so that when the National Cancer Strategy is called, we have a proper kind of agreed plan with regards to research in Ireland. So ever since I was in SHO, we've talked about personalised medicine, but I would argue in cancer, outside of hematological malignancies, we don't have that many great examples of true personalised medicine. And the haematologists around us here obviously will be very clear about the fact that they have been way ahead of us. But I guess within solid organ malignancy, you could argue that outside of HER2 and obviously the successes that have been made in lung cancer, that apart from things like mismatch repair deficiency and rather bland personalisation, we really haven't got to that level of personalisation that we had expected we would get to in the year 2000. But of course, Hippocrates was talking about this long before that. And my own feeling is that we've spent far too much time focusing on the tumour and not near enough time focusing on the person. And what we're trying to do in POI 2 is bring that combination of the I suppose the technologies we now have to profile tumours to try and understand how we can understand how the person may alter that impact as well. So like most things in life, you stand on the shoulders of giants, and POI 1 was I would say a hugely important step forward for Irish cancer research, as I said, led by Walter and Liam, and it was hugely successful. It was obviously Claire was the Cancer Society were hugely important with regards to this, but it was the first time I would argue that academia, charities and industry came together, and there's no doubt that at the start there were teething problems, but by the end I think we would all agree that it's been a very successful endeavour. And this is just some of the outputs from POI 1. You can see really quite very well established outcome measures and impacts. But I would say the biggest thing that POI 1 did was it built a community of people who want to work in translational research in Ireland and want to try and make things better. And we've also managed to train a huge number of very talented PhD and postdocs, and really that's what we wanted to build on going forward. So this was the start of POI 1. It was a national network of, I suppose, with international reach. But you can see this is where it's got to, and I think that shows the benefit that the investment of 11.1 million was, I would say, at least trebled and probably quadrupled in reality. And that's down to all those individual investigators, but it's also down to the fact that people are going in the same direction. These were the international reviewer perspectives, and really they were very good, and I'm not going to read them out and bore you with them, but from our interim review of POI 1, we were given a very clear indication that we should apply for more funding. So it's very unusual for Research Ireland to fund one of these strategic partnership groups for a second time. The idea is that it would be expected to just go itself, but we've managed to convince them, and a number of us can be quite persuasive sometimes. I know that might be hard to believe, but we can be persuasive sometimes. But really what we want to do, and what was clear, was we want to really build those alliances between basic or blue sky thinking all the way through to delivery of clinical trials. And I think that's why it's important that people here today understand that this is a really important step forward for those of us who work in clinical trials, and it's not simply a translational research exercise. So we had multiple engagements, and one of the key engagements was with the DSSGs here in Cancer Trials Ireland. And I think it was a very fruitful engagement. From I suppose, a scientific perspective, it was very helpful. We were really kind of blown away by the interaction with, say, the clinical trialists who had not participated in translational research previously. And it really did help us develop some important ideas. And one of the work packages is obviously around the molecular tumour boards. The Cancer Trials Ireland and Dervla Collins and colleagues have worked so hard to keep up and running for so many years. So as a result of the success of POI1, we have had expanded buy-in. We've had an additional university come in, DCU. So 5 of the 6 academic partners are regional, within the regional health group system. I'm not going to start talking about the regional health groups, or I'll get blood pressure. We increased our charity partners from 6 to 9. We brought in 7 hospital foundations, which I think is a really important thing, because it allows us to get our message out to the patients on the ground. And the hospital foundations are very good at that. And we increased our industry partners from 7 to 10. So really, it shows that the success of POI1 meant that POI2 became a much bigger endeavour. And ultimately, the funding model is that 50% of the funding is provided by the state through Research Ireland, and 50% is provided by the partners. And just to give you an example, and I'm not going to suggest that I'm not going to step on people's toes and present their work packages, but our own work package in POI1 was a large project with AstraZeneca, looking at improving immune checkpoint inhibitor therapy, particularly in ovarian cancer. And as a result of this piece of work, we were able to form agreements with AstraZeneca. So within the lab, we have compounds that will never get into patients, but we also have compounds that are now in phase 1-2 trials, bispecific antibodies, novel immune checkpoint inhibitors, T-cell engagers. And it's been a very fruitful interaction. And as a result of that interaction, what happened was we presented that to the Cancer Trials Ireland DSSG group, and we came up with a very nice project around treating peritoneal carcinomatosis, irrespective of the organ of origin. But I do think, and not solely, but as a result of the interactions we had with AstraZeneca, as you know, AstraZeneca have invested hugely in their site up in Blanchardstown. And we now have 2 projects with AstraZeneca, one with AstraZeneca UK Cambridge, and one with AstraZeneca Dublin with Personalised Medicine group here. And I think it shows that the investment is increasing, and we're able to develop those partnerships. And there's no doubt that historically, interactions with pharma were difficult when it came to translational research, but I think that has changed completely. And we also have another project with GSK outside of POI2, so I think pharma are willing to come and fund translational research within the universities now. So the vision is really to complete that circle, bringing advances in basic research to patients and co-developing those very much in an EPE fashion. And EPE is a major problem. And the budget for EP in this grant is over 1.5 million, and it shows, as Claire said, that Ireland is way, way, way to the forefront of actually understanding how patients interact and co-design these studies going forward. But also bringing clinical questions back to the lab in Ireland, so that if there are clinicians who are working in Ireland, that they don't feel that they have to go back to their lab that they trained in San Diego or San Francisco, that there is a group of scientists in Ireland who are willing to do this. We have 38 investigators, 31 projects, 1 goal, and a budget of 27 million. So there's a very significant responsibility associated with this investment to deliver appropriate results. And we hear a lot about funding, but we do invest a lot of money in cancer research in Ireland, and I think it's time we start to deliver. And the way we deliver is through, consortiums like this, where we can really get everybody working together. So, just to show you, we've added interdisciplinarity, expanded scientific scope. We've definitely extended infrastructure. For the first time, we have an EPE program. POI1 did an amazing job, most of it led by Liam and Claire and others in the ICS around EPE, but now we actually have a full EPE program. We will be training a large number of PhD students. It's between 40 and 50. We advertised the first tranche recently for 12 to 15 positions, and we had 320 applicants, and I can tell you the standards were absolutely amazing. In fact, thank God I wasn't on the interview panel. And obviously we're building that community spirit. And these are our research objectives. I'm not going to go through all of them in great detail, but ultimately Ireland, I think, if it's at the forefront of patient engagement, it's also at the forefront of computational biology. And that's one of our major strengths. And what we really want to do is use the digital twin model as a kind of an embracing approach to how we manage these multi-omic data sets that I'm going to talk about. So digital twins, without boring you too much, is work that has obviously emanated from SBI. I've been working in SBI for the last 10 years. And we've been really trying to develop this model, and it's been a very slow process. But with the advent of AI over the last 2 or 3 years, it's really changed. And to put in context, 7 or 8 years ago, it took 2 years to build the first digital twin. You can now build a digital twin in about 2 weeks with AI because the coding is so much more straightforward. And it basically involves multi-omic integrated analysis and using different models to try and identify areas where the tumour might be specifically suitable for treatment, and then actually testing that with specific perturbations. And that's the pathway, and as you can see, it's been a slow process, but I think we are starting to move now into that process where we are getting to a point where we can say we can make these digital twins, and POI funding has been really important. And from a clinical perspective, I think that might seem a little bit daunting, but it's actually not that daunting. So ultimately what we look at is integration of multi-omics, and then obviously Walter and Boris published their C-STAR, which is a way of analysing this data and identifying areas of or nodes of interest in nature 2 years ago. And then we go on and we basically look at different ways of mechanistically modelling this within, usually within cell lines or tumour explants. And you might say, oh, that's really difficult, but ultimately what we've learned is that with transcriptomics and proteomics alone, we can probably do most of this. We can do it in the lab, and we're starting to do it at a clinical level at this stage. And this just shows you one of those models, and I decided I wasn't going to show you an ovarian cancer model, just out of conflict of interest perspective, really. But Magic Eye, I think Ireland is at the forefront of where we're moving with molecular profiling of childhood cancer. And all childhood cancers in Ireland, through a work between POI and obviously CHI and the Children's Health Foundation, are now being offered whole genome and whole transcriptome sequencing, and we now have the pathways in place to actually analyse those. And the first 60 kids have now been analysed, albeit in hematological tumours, but we are now moving towards CNS tumours, and the pipeline has worked really well. So I think we're really in a position where we will know very quickly whether this can really work in the clinic. So just to finish up on the structure of POI, there are multiple work packages, multiple tumours. It's very large. I'm not going to go through it all, but you can see that we're trying to look at multiple different cancer types with a specific focus on early onset in lung and GI, and there are multiple groups looking at early onset GI cancers, obviously with the epidemic that we see there. And as I said, we have this molecular tumour board partnership as well, which I think is really important. And to me, the benefit of this work package is not only for the patients on the molecular tumour board, but it's even a forum for training for PhD students and postdocs, so they can actually see how this would work in the clinic. And you might be used to this happening, but actually crossing that bridge can be quite difficult. Sometimes some of the greatest kind of insights that we get are when we're operating ovarian cancer patients and the PhD students and postdocs actually come to theatre and actually see it in actual real life, and they can really kind of understand things in much more detail then. So the leadership is really multidisciplinary, and that was really part of the process of putting it together, where we have clinical and non-clinical leads across all of the work packages, and the training and work package 5 is led by Leonie, Darren, and Liam. And really, as I say, that will be a hugely important piece, and the investment by Trinity and RCSI in that training piece has been really, really important. So these are what we aim to achieve. Again, I'm not going to go through them all in great detail, but I would say that the one thing that we do plan and we've started is our EPE program, and the patient involvement is embedded throughout the process. So really, POI does mean working as a team across the board, and it's a big technical experiment, but as Walter often says, it's a big social experiment as well. And I think if it works as well as POI 1 did, we will see really good outcomes. So this is the leadership team. Everybody's in place now. As you can see, we have a senior manager, but also down the bottom you can see Yvonne Amara and Laura Rice are heading up the EP program, and I think that's going to be one of the really exciting parts of the program. So thank you very much.